Hi everybody, it's me, Dr. Gonzalez, and I thought I would go over today kind of some of the most common questions that we get asked here at Acadia Women's Health. And one of the things I get asked about is about Miami a lot. And I'm from Miami, actually. I grew up all my life in Miami. I went to medical school there, and I even did a lot of my cosmetic surgery training with Dr. Carlos Spera, who is a plastic surgeon out in the Miami area. I want to tell you a little story first about another good friend of mine who I recently spoke to, who's also a cosmetic surgeon in the South Florida area. And he had come to me because he was leaving a job where he was working at another company where they were doing a lot of cosmetic surgery. And what he found was a lot of those consultations actually had never seen him. He didn't actually get to meet the person until the day of the surgery, so he didn't get the person cleared. He didn't know anything about the person's medical history. And he had expressed a lot of frustration to me about this particular predicament he was in, because when he had originally signed on to work for this company, that wasn't his impression on how things were going to go. So just to make it clear, a lot of the patients that he would see in Miami and operate on, or at least initially before he decided he was no longer going to work under those conditions, were from patients who were remotely, had their consultations done, meaning their consultations, they may have been in another state when they had their consultation done. That consultation was just done by a salesperson. It wasn't done by anybody with any medical training. It wasn't done by the doctor. And even their pre-op visits and pre-op blood work and all of those other things were done without the doctor's knowledge or consent about the actual patient. And he said this was not unique for that area. So I always tell patients, be really careful when you find a doctor who speaks ill of other doctors. So understand that that's not what I'm doing here with this discussion today. What I'm really trying to do is make sure that you know that not all places are the same. And a lot of places and businesses are actually run just for-profit businesses that their whole intention is to run through as many patients as they can and see and operate on, and they just hire surgeons to do the surgeries, kind of almost as like a mercenary, where they're just there to do surgery and they never saw the patient before, never did the consultation, and don't see the patients. So here at Acadia Women's Health, we do something different. You're going to go ahead, and even if your consult is done remotely, because we do some of them that way, they're typically done by one of our providers, most likely a physician, but it could also be done by our nurse practitioner. All surgeries, histories, and pre-op photographs are cleared with the surgeon who's going to be performing your surgery way before actually the surgery or preoperative dates. And when you come in for your preoperative visit, that preoperative visit is going to be done by the surgeon who's going to operate on you. So those are really important distinctions. So be careful. Now, not all doctors in South Florida are like this. Dr. Spera, who I work with, is phenomenal, and he doesn't have that type of practice. But a lot of the ones that you're finding on the internet, a lot of the ones that you're reading about where you fly down just for a couple of days and come on back, just realize that you don't know exactly who's operating on you. You don't know their qualifications. They don't know you and your medical history. And like my friend would tell me, who's no longer in that position, he decided to give up that job and work somewhere else. You'll find that a lot of the times that isn't the surgery they would have recommended for you to have done at the time. And there were many times he actually canceled the surgery on the day of the patient was intended to originally have that surgery. So just a little word of wisdom for you to take into account when you think of traveling abroad for your surgery. Again, there are a lot of legitimate places in South Florida, but you really want to be cautious, and you want to make sure that you know what type of business establishment you're dealing with. So it's great to kind of reach out to you. Again, this is in Miami. I hear about a lot, and I'm from there, trained there. So just realize, sometimes Miami's right in your own backyard. It's here in Raleigh. So good to see y'all. Y'all take care. God bless.